Welcome back to Mayo Clinic Radio. I'm Ian Roth.
And I'm Tracy McCrae.
Snoring is often associated with a sleep disorder called obstructive sleep apnea, or OSA. People with OSA often snore loudly and have breathing patterns where they stop breathing and start again over and over while they sleep. According to the Centers for Disease Control and Prevention, at least 18 million adults in the U.S. have sleep apnea.
While it's unclear whether or not sleep apnea directly causes heart disease, we do know that people with sleep apnea are at risk of developing hypertension or high blood pressure. And according to a new study, snoring and OSA may lead to heart problems earlier for women than for men. Here to discuss snoring and the effect on cardiovascular health is Mayo Clinic cardiologist Dr. Virend Somers. Welcome to the program, Dr. Somers.
Thanks, Tracy, and thanks, Ian. It's a pleasure to be here.
Why is it that figuring out, I think anybody who sleeps in the same room or the same bed with someone knows if they have sleep apnea, but why is it important to diagnose it?
So sleep apnea has several issues. The first is just the fact that the bed partner is disturbed. So what we find is that the bed partner of people with significant sleep apnea actually are themselves clinically sleep deprived. So right at the outset, we have the issue of the bed partner having health risks from sleep deprivation because of the snoring of the other partner. For the person who snores, and not everybody who snores is at risk, so we have to remember that snoring is a continuum. So it's like blood pressure. It goes from mild, from non-existent to mild to severe to plain apneic snoring. And you know, very often people who snore also have obstructive sleep apnea. And the ones who snore very disruptively, who actually stop breathing during sleep, the bed partner sees it, what we call a witnessed apnea, those people almost certainly have significant sleep apnea. For the people who snore without diagnosed sleep apnea, you can imagine that a substantial percentage of them actually have sleep apnea as well. So we have to think that maybe the harm from snoring actually comes from the fact that they have undiagnosed sleep apnea.
So why, we know that sleep apnea can be hard on the heart. Why is that? Why is it causing problems in the heart?
For many reasons. So the first reason is that when you have apnea, you stop breathing. So your oxygen level falls and your carbon dioxide level goes up. Those two changes, a low oxygen and a high carbon dioxide, actually trigger receptors in the peripheral blood vessels and in the brain that increase your sympathetic nerve traffic. So sympathetic outflow is your fight or flight response. And it is an adrenaline-like response that causes your blood vessels to vasoconstrict, in other words, to tighten up. So that raises your blood pressure. So with every apnea, you have a very marked increase in blood pressure, sometimes to levels as high as 200 during sleep. Okay, so that in itself, those repetitive increases in blood pressure tend to put some stress on the heart and raise the blood pressure, and thereby increase the thickening of the heart. The second problem with sleep apnea in the heart is because these people are struggling to breathe, you got to get back to why are they not breathing well. They are obstructed because during inspiration, the upper airway collapses like a wet paper straw. Why does it collapse? Because when they're asleep, particularly when they're dreaming, they lose muscle tone. So they lose muscle tone in the body, and that's designed to stop them from acting out their dreams. The problem is we also have muscle in the upper airway, and that muscle also loses its tone, which means that when they breathe in, the airway collapses. Okay, so that's obstructed. So what does the patient do? He or she breathes in really deeply, struggles, and creates a huge negative pressure in the chest to try and overcome that blockage. Now, that negative pressure is being created around the heart. And parts of the heart are very thin-walled, like what we call the atrium, the upper chamber. So if it's like putting the atrium or the heart into a vacuum. Okay, so it stretches the heart, causes the heart to stretch outwards, particularly the atrium, because that causes what we think of as left atrial enlargement. So there are several other mechanisms by which the heart can be damaged, but those, I would say, are the two principal ones. the fact that blood pressure gets up to very high levels during sleep, and the second being that the heart is constantly subjected to these repetitive episodes of negative intrathoracic pressure in the chest, negative pressure in the chest during sleep.
If people have high blood pressure when they're sleeping, damaging the heart while that's happening, while they're sleeping, but during the day, do they still have high blood pressure? Or when they go in to get their blood pressure checked, is it regular?
Right. So great question. So what we're finding is that if you have this high sympathetic drive during sleep, this adrenaline drive, that seems to carry over into daytime wakefulness. So if you look at sympathetic activation in an untreated apneic patient, they will often have very high levels of sympathetic activity. Now, what about blood pressure? That is true for blood pressure as well. These high levels of blood pressure seem to predict the development of high daytime blood pressure in the future.
Why may women be at greater risk than men when it comes to sleep apnea and heart disease that is caused by it?
Right. So to put this in perspective, at this point we have some indications that women may be at greater risk, although the evidence is not compelling and definitive. And why is that? It's because women, so 1 in 4 middle-aged men probably has significant sleep apnea. 1 in 10 middle-aged women probably has significant sleep apnea. This means that sleep apnea seems to affect men far more than women. Because of that, apnea in women hasn't received as much attention. Most of the patients are men, so everything's being done in men. The studies are being done in men. Women are kind of been, I wouldn't say neglected, but yes, neglected. Mainly because it's less prevalent in them. But what we're finding is that, yes, it may be less common, but it's not in any way less dangerous. So why it may be more harmful in women? First, we've got to establish, yes, it is more harmful. And second, identify why. A couple of things to bear in mind is that, especially after menopause, the prevalence of apnea in women seems to be significantly increased. So it's when as they get older, they tend to have a higher level of sleep apnea than before menopause, and that may be in part due to weight gain around the abdominal area, maybe some fat accumulation around the neck, and whether the absence of the protective benefit of being premenopausal is lost after menopause, and that double whammy of A, losing the protection that you get when you're younger and then being postmenopausal, and then B, developing sleep apnea on top of that. Maybe that's why it's more harmful, but we still have to investigate that.
We only have just about half a minute left.
Yes.
If it's bad, if sleep apnea is bad for your blood pressure, is it also bad for arrhythmia or strokes or heart attacks?
Very much so. People who have sleep apnea have a much higher likelihood of cardiac arrhythmias, particularly atrial fibrillation. Why is this? It's because the atrium is the part that gets stretched the most when they're apneic. They certainly have a higher risk for strokes, and there are many reasons for this, including the fact that sleep apnea makes the blood more coagulable. And yes, they have a higher likelihood of heart attacks, particularly heart attacks that occur during the night. So if a patient has a heart attack that occurs at nighttime when they're asleep, that wakes them from sleep, you really have to consider whether they have sleep apnea. Now, having said all this, I want to point out that we still have not proven that treating obstructive sleep apnea lowers the risks of atrial fibrillation or heart attack or stroke. We think it will, but we still don't have the definitive evidence to prove that that's the case. We do know sleep apnea treatment decreases your level of daytime sleepiness, which means you're at lower risk for motor vehicle accidents and at lower risk for accidents at work and at lower risk for being away from work because of sickness.
We've been talking about obstructive sleep apnea and cardiac risk with Mayo Clinic cardiologist Dr. Virend Somers. Thanks for joining us, Dr. Somers.
Thanks very much. Thanks, Tracy. Thanks, Ian.
And that's our program for this week.